Hi everyone, this is Mrs. Correa. I hope all of you are doing good with your reading and studying. And welcome to week 2 lecture. The topics included in this week are signs of pregnancy, establishing expected date of delivery, pregnancy classification system, physiological changes during pregnancy, and psychosocial changes. Signs of pregnancy. They are classified into presumptive signs, probable signs, and positive signs. Let us talk about presumptive signs first. They are subjective signs of pregnancy because these symptoms may be caused by other conditions. They are the least indicative of pregnancy. First one is amenorrhea, that is absence of menses. It is significant in a woman who has regular menstrual cycle. So it is not significant in a woman who has irregular menstrual cycle. Nausea and vomiting, it is otherwise known as morning sickness. Urinary frequency is caused by pressure exerted on bladder by enlarging uterus. Breast tenderness results from hormonal changes during pregnancy. Quickening, they are perception of fetal movement occurs during the second trimester. The sensation of fetal movement may also result from flatus, peristalsis, and abdominal muscle contractions. Striae gravidarum, they are skin changes include stretch marks and increased pigmentation. Fatigue may also be associated with illness, stress, or lifestyle changes. Probable signs of pregnancy. Probable signs of pregnancy are objective indicators that are observed by the examiner because they may be caused by other conditions. A positive diagnosis cannot be based on these findings alone. They are abdominal enlargement, Peiskasek sign, it is uterine asymmetry with a soft prominence on the implantation site. It may also be associated with uterine tumors. Hagar sign, it is softening of the lower uterine segment. It may also result from pelvic congestion. Gödel sign, it is softening of the tip of cervix. It can also result from infection, hormonal imbalance, or pelvic congestion. Chadwick sign. It is violet bluish color of the vagina and cervix. It can also result from pelvic congestion, infection, or a hormonal imbalance. Braxton Hicks contractions. Intermittent uterine contractions. They may also be associated with uterine leiomyomas, that is fibroids or other tumors. Then ballottement, it is passive movement of the unengaged fetus. Positive pregnancy test may occur from certain medications, premature menopause, choriocarcinoma, or presence of blood in the urine. So due to this reason, even if a pregnancy test is positive, this does not confirm pregnancy and it is still considered as a probable sign. Positive signs of pregnancy. They are presence of fetal heartbeat, visualization of the fetus, and fetal movements palpated by the examiner. How to establish estimated date of birth, or EDB. It is also known as estimated date of delivery. Naegeli's rule, it is adding 7 days, then subtract 3 months from the date of the patient's last menstrual period. Very important to remember this. An alternate way is add 7 days and then add 9 months plus year where needed. I have explained this during clinicals, and if I don't meet some clinical groups before this class, I will explain this to you during your first clinical day. Pregnancy classification system. We need to know few terminologies. First one is gravidity. It is number of times that a woman has been pregnant. Parity. It is number of pregnancies carried to a point of viability that is generally accepted as 24 weeks of gestation. Carefully listen to this. In some books you may see point of viability as 22 weeks of gestation, but in our book and generally accepted as 24 weeks of gestation. GTPAL classification. G stands for gravida, T is for number of term pregnancies, P is for number of preterm pregnancies, A for number of abortions, both spontaneous and induced, L for number of living children. Physiological changes during pregnancy will be discussed system-wise now. We will start with reproductive system changes. Uterus. Patterns of uterine growth is very predictable for the first 20 weeks of pregnancy. By end of first trimester, uterus rises out of pelvic cavity and becomes an abdominal organ. Please remember this. By 20 weeks, it reaches at the level of umbilicus. And due to the influence of estrogen and progesterone, myometrial cells and muscle fibers undergo hyperplasia, hypertrophy, and allow uterus to enlarge and stretch. And the uterus weight increases from 70 to 1100 grams at term. Estrogen causes Braxton Hicks contractions. These are contractions of the uterine muscles. These contractions are irregular and painless. It may begin as early as the 16th week of gestation. Braxton Hicks contractions prepares uterine muscles for synchronized activity which is necessary for effective labor. If these contractions are irregular and last less than 60 seconds, reassure woman. And if these contractions are regular pattern or associated with other symptoms, seek medical attention. Changes on cervix. They are Chadwick sign and Goodell sign. We have already discussed those. And cervix softens. Mucus plug forms. It is otherwise known as operculum. Increased whitish vaginal discharge develops. It is otherwise known as leukorrhea. Call if discharge is bloody or yellow-green or foul odor, itching or pain. Otherwise, leukorrhea is normal. Changes on vagina and vulva. They are thickening of vaginal mucosa. The rugae deepen from hyperplasia and hypertrophy of the epithelial and elastic tissues. Becomes edematous from poor venous return caused by weight of the gravid uterus. More susceptible to yeast infections. The pH decreases from 6.0 to 3.5. And we should always discuss vulvar hygiene with the patient. Changes on breast. Breast enlargement, fullness, tingling and increased sensitivity. Montgomery tubercles on and around areola enlarge and provide lubrication for nipple tissue, which is very important during breastfeeding. Increased pigmentation of areolae. Striae gravidarum or stretch marks develops. Colostrum present around 16th week of gestation. And we need to discuss on bra size changes options for infant feeding, and strategies for successful breastfeeding with women. Integumentary system changes. Hyperpigmentation. They are chloasma. It is otherwise known as mask of pregnancy. You will see some dark areas on the face of pregnant woman. Linea nigra, it is dark line, extends from umbilicus to mons pubis and sometimes upward to the xiphoid process. So you will see all the way from mons pubis to xiphoid process in some women, and in some women it is from umbilicus to mons pubis only. Then cutaneous vascular changes. Striae gravidarum, it is otherwise known as stretch marks. Angiomas, they are vascular spiders, are tiny bluish end arterioles that occur on the neck, thorax, face and arms. Palmar erythema, they are diffuse reddish pink mottling of the palms. Under neurological system changes, you will see decreased attention span, poor concentration, memory lapses, carpal tunnel syndrome, manifested by pain and paresthesia, syncope. If lightheadedness or other warning signs are experienced, instruct women to assume sitting or lying down position. Left side lying down position is preferred to avoid supine hypertension. Please remember this. And always give anticipatory guidance regarding these changes. Cardiovascular system changes. Heart position pushed upward, laterally to left. Cardiac hypertrophy due to increased blood volume and cardiac output. Heart sounds, exaggerated first and third heart sounds, and systolic murmurs. Little side note to systolic murmurs. Some systolic murmurs are physiologic, and you will learn this in cardiology in your medical surgical class. And also you will see some systolic murmurs in pediatric population. They are just physiologic. They are called innocent murmurs or still murmurs. But always remember, diastolic murmurs are pathologic and systolic murmurs are not always pathologic. It could be just physiologic. And systolic murmurs usually resolve within first 2 weeks postpartum, that is after the baby is born. During pregnancy, plasma and erythrocyte volume increase. Plasma volume increases around 50% and erythrocyte volume increases around 30%. So the increase in plasma volume is greater than the increase in erythrocyte volume. So the hematocrit decreases by 7% due to hemodilution, and this is called physiologic anemia of pregnancy or pseudoanemia. And we should always teach regarding adequate hydration. The mother should drink at least 8 to 10 glasses of water and diet high in protein and iron. There is increase in leukocytes from 5,000 to 15,000, and during labor and postpartum may increase up to 25,000. The plasma proteins increases and increased fibrinogen volume as much as 50%. Production of immunoglobulins are unchanged, but the circulating levels of IgG, that is the immunoglobulin G, and which is the only immunoglobulin transported across placenta, are decreased. The cardiac output increases, pulse rate increases, there is increased blood pressure after 20 weeks of pregnancy, stasis of blood in lower extremities occurs, and there will be a risk for varicose veins and venous thrombosis due to this stasis of blood in the lower extremities. We should always encourage daily walks to enhance circulation and improve intestinal peristalsis. What causes supine hypotension? The pressure from enlarged uterus decreases venous return from lower extremities, and the patient may have hypotension, dizziness, diaphoresis and pallor. Orthostatic hypotension. that is due to stagnation of blood in lower extremities, and we need to encourage women to rise slowly and keep feet moving while standing. And as a note, all of these changes in circulatory system return to normal by second to third week of postpartum. Respiratory system changes. There will be increased tidal volume, increased oxygen consumption, elevated diaphragm due to upward pressure from enlarging uterus, increased chest circumference and dyspnea. And we need to educate regarding normal changes and symptoms so that the woman is aware of these changes. Changes on eye. Blurred vision can caused by decreased intraocular pressure and corneal thickening. We need to tell the mother that it is a temporary condition. Changes on nose, nasal stuffiness and congestion, and which is also called rhinitis of pregnancy from increased mucus production. And epistaxis can result from edema, which is an effect of estrogen along with vascular congestion can cause this epistaxis. And we need to always encourage increased fluid intake. Changes on throat, hyperemia, it is a congestion occur from increased blood flow and relaxation of smooth muscle. Changes on GI tract. Mouth, you will see gingivitis, which is inflammation of gums, hypertrophy of gums, epulis gravidaris, which is red raised nodules appear at the gum line, thialism, which is excessive salivation. Changes on esophagus, you will see pyrosis, which is otherwise known as heartburn, and woman may have reflux. We need to advise to eat small meals and avoid lying down after meals for at least 1 hour. Changes on stomach. Mom will complain morning sickness, which is nausea and vomiting early in the morning. Large intestine changes are constipation. And changes on liver and gallbladder. Pruritus gravidarum, it is severe itching due to stasis of bile in the liver, and we need to advise to avoid high fat meals to reduce presence or frequency of these symptoms. Please remember this. And you will see cholestasis, which is stasis of bile, cholecystitis, which is inflammation and infection of gallbladder, and cholelithiasis, which is gallstone formation. Bladder changes. Urinary frequency and urgency increases. When uterus becomes an abdominal organ, the bladder pressure is relieved and most of the frequency and urgency is relieved. At which week the uterus becomes an abdominal organ? At 12 weeks. And the UTI occurs more frequently in pregnancy. Changes on endocrine glands. Changes on thyroid gland, there will be increased T4 levels and progressive increase in basal metabolic rate. Parathyroid gland increases in size. Changes on pituitary gland. The prolactin increases tenfold during pregnancy. Increase in oxytocin, which causes uterine contractions and stimulates milk ejection from breast, otherwise known as let down reflex. Vasopressin causes vasoconstrictions, leads to increased blood pressure and maternal fluid retention from antidiuretic effect. The adrenal glands produces increased cortisol and aldosterone, an increased number and size of beta cells in pancreas. The prostaglandins, they are found high in concentration, and at term increased release of prostaglandins from cervix cause softening and dilation of cervix and may contribute to the onset of labor. So remember this. In some cases, when we are trying to induce labor, we use Cervidil, which is basically a prostaglandin. So what does it do? Basically is softening and dilation of the cervix. Musculoskeletal system changes. As pregnancy progresses, the abdominal wall weakens and the rectus abdominis muscles separates, which is called diastasis recti, to accommodate the growing uterus. The relaxin and progesterone causes laxity of the ligaments, and the symphysis pubis separates at approximately 28 to 30 weeks. There are some postural changes occurs, that is lumbar lordosis, which is anterior convexity of lumbar spine, and the pregnant woman will have a waddle gait. Let us talk a little about psychosocial changes. There will be decreased ability to deal with stress and cope with changes of pregnancy. The major developmental phases are ambivalence and conflicting emotions. And always the nursing care should be tailored through each pregnancy milestones. I would like you to read the table 8.4 for health education topics related to psychosocial adaptations to pregnancy. Few words about pregnant adolescent. The normal adolescent developmental tasks conflict with tasks of pregnancy. What is a normal adolescent developmental task? As per Erickson's stage, it is identity versus role confusion, right? So that is conflicted with the tasks of pregnancy. They may not seek prenatal care, they are not future oriented, may not accept reality of unborn child, and the acceptance of pregnancy is hindered. So that comes to the end of week 2 lecture. I would like you to read my PowerPoint, listen to the audio, and read the assigned readings as per your course outline and add notes to it. And thank you for listening.